Welcome dear students. I am Professor Mohamed Laban. Our topic today is on Cesarean section. By the end of this lecture, you should be able to list the different indications for Cesarean section. Appreciate the reasons behind the rising incidence of Cesarean section. Recognize the technique of the different types of Cesarean section. State the complications of Cesarean section. Enumerate the advantages of lower segment Cesarean section over upper segment Cesarean section. Cesarean section is a delivery of the fetus through incisions in anterior abdominal, laparotomy, and uterine wall, hysterectomy. Indications of Cesarean section. A. Based on urgency. Absolute or relative. Emergency or elective. B. Based on prognosis. Maternal indication. Fetal indication. Combined. C. General indications, based on certain clinical situation or diagnosis. The following indications are the most frequent. A. Abnormalities in the passage. Contracted pelvic, one or more of the diameters is reduced and interferes with normal mechanism of labor. Cephalopelvic disproportion, the head of the fetus is relatively large to pass through the pelvis. Placenta previa, implantation of placenta in the lower uterine segment. Carcinoma of the cervix. Cervical dystocia, failure of the cervix to dilate in spite of strong contraction of the uterus. Vaginal scarring. B. Abnormalities in the passenger. Malposition and malpresentation. Prolapse of the umbilical cord. Fetal distress. Fetal macrosomia. C. Abnormalities in the forces. Failure of labor to progress despite adequate stimulation. Uterine inertia, inefficient uterine contraction. D. Others. Premature separation of the placenta, accidental hemorrhage. Previous uterine scars. Maternal and obstetric medical problems. Preeclampsia/eclampsia. Heart diseases. Renal diseases. The rate of cesarean deliveries has increased over five-fold, from 5% of births in 1970 to at least 25 to 30% of births currently in USA. The dramatic increase in the cesarean delivery rate has been attributed to many factors, including assumed benefit for the fetus. Women are postponing childbirth until a later age, when the risk is higher. Relatively low maternal risk in general. Societal preference. Fear of litigation. Types of cesarean section. Based on uterine incision. Classical or corporal, vertical incision. Low segment, horizontal incision. Based on time. Emergency CS. Elective CS. Other. Extraperitoneal CS. Cesarean hysterectomy. Indications of classic CS. Difficult to reach the LUS. Transverse lie. Fetal distress. Placenta previa, anterior implantation. Followed by sterilization. Advantages. Faster. Easier. Disadvantages. Bleeding may be more profuse. Difficult to extract the fetal head. Risk of rupture during future pregnancy. Indications of low segment CS. Longitudinal lie. No problem with the LUS. Future pregnancy is expected. Advantages of low segment CS. Less bleeding. Incision to placenta is avoided. Easy to extract fetal head. Easy to close, suture. Good reperitonization. Risk of rupture in the next pregnancy is minimal. Disadvantages of low segment CS. Takes more time. Bleeding may be more severe, if the incision extends too laterally. Injury to the bladder may happen, if the incision is too low. Cesarean hysterectomy. Definition: Cesarean section followed by hysterectomy. Indications: uncontrolled bleeding, placenta accreta, multiple uterine myomas, cervical or ovarian cancer, unrepairable uterine rupture, infection, intraoperative complications of CS, bleeding and the need for BL transfusion, hysterectomy, complications of anesthesia, damage to the bladder, ureter, colon, retained placental tissue, fetal injury, postoperative complications of CS, gaseous distension, paralytic ileus, wound dehiscence and infection, infectans UTI, pulmonary, DVT and pulmonary embolism, death. Vesicouterine fistula. Case 1. A 30-year-old nulliparous woman attends your antenatal clinic. She is 24 weeks pregnant. She tells you that she would like to book a cesarean section. Q1. What further information would you ask for from this patient? The patient tells you that she has a friend who experienced a traumatic vaginal birth after a prolonged labor. She admits to feeling terrified and has been having nightmares. There are no clinical indications for cesarean section, but she is clearly anxious. Q2. What action should you take? After discussion with the patient, she is still anxious about labor and vaginal delivery. Q3. What action should you take? The patient remains anxious about giving birth vaginally and would still like a cesarean section. Q4. What action should you take? Case 2. You review a patient Paro 1, on a postnatal ward round. 2 days ago she had an emergency cesarean section in labor for dystocia and fetal distress. She asks you about the operation, and how it may affect her future pregnancies. Q1. What information should you give to her? 2 years later, the same patient returns to your antenatal clinic, expecting her second child. She would like to plan a vaginal birth. Q2. What additional care should Jill be offered during labor, in view of her previous history of cesarean delivery? Thank you.